Tell me what you're seeing in the labs to diagnose it, to help
So
diagnose it.
we'll see that flipped FSH and LH. That's one big red flag. We also will look at the thyroid. Usually the free T3 levels are lower in the two ranges. You'll see a high free testosterone generally, not always, but you can. And, a lot of this is complicated by whether or not someone is on birth control pills, because that can mask the symptoms. It can change the lab results because it drives down the FSH and LH. And so we're always looking for that flipped FSH and LH in someone that we suspect has it. But there was also a study back around the same time, 2017, where they looked at the prevalence of PCOS. And there's 3 different sets of diagnostic criteria. And researchers have recently come out, very vocal about we need to revise the criteria. It's not up to date. It's not current. It's not adequate. And so it needs to be revised. But unfortunately, that's still what's used. And there's 3 different sets. And they don't all have the same criteria listed. And so it depends on which diagnostic criteria your provider uses as to whether or not you get an accurate diagnosis. And so we look at the symptoms. With diagnosis of PCOS, I kind of compare it to putting pieces of a puzzle together. You don't have to have all of the pieces there to be able to start to get a clear picture of what's going on. But if you get enough pieces of that puzzle, then you can see, okay, this is what's causing this problem. And then when we start to treat it, you see symptoms improve, which then verifies what we believe based on symptoms and also lab values.